Thank you, everyone, for getting here. This is once again Public Health and Minority Health Disparities Subcommittee. We have 4 bills on the agenda. We are holding House Bill 1376. So we have four bills on the agenda today, some of which I think we're going to be able to move on, some of which we're getting an update, and we may or may not have consensus. But we're going to start with the easy ones. So we're going to start with House Bill 1100, Public Health Equity Dashboard. And Erin, if you can talk us through the bill.
You have a reprint of the bill that has an amendment that's being offered by the bill sponsor, who's Delegate White Holland. The bill requires MDH, in collaboration with the Maryland Commission on Health Equity, to develop a clear and easy to understand graphic data dashboard that includes age-adjusted health disparity data disaggregated by race, ethnicity, and gender. The data dashboard must include information on health insurance access, cardiovascular disease, chronic disease, mental health and substance abuse, cancer, HIV/AIDS, sexually transmitted infection, and any other health indicators determined relevant by MDH. The bill has introduced required MDH to update the data dashboard at least every 30 days and post the most recent updated data dashboard prominently on its website. The amendments would require the dashboard to be updated quarterly as data is available, and this was the amendment requested by the department.
Thank you very much, Erin. And as I recall, there was no opposition testimony. There's no fiscal impact. And am I correct with this amendment, the bill's identical to the Senate cross-file?
Yeah, as identical to the Senate cross-file as it passed finance.
Perfect. Thank you, Delegate White Holland, for your work. And with that, do I have a motion on the amendment?
Move the amendment.
Do I have a second?
Second.
All right, it's been moved and seconded. Any discussion on the amendment? All right, all in favor say aye. Raise your hand. Anyone opposed to the amendment, go ahead and raise your hand. I'll give everyone a moment. All right, that is unanimous. Do I have a motion on the bill as amended?
So moved.
Second.
All right, it's been moved and seconded. Any further discussion on House Bill 1100? All right, all in favor of the bill as amended, say aye or raise your hand. Anyone opposed? Delegate Lopez, are you? I just want to make sure we're recording you correctly. All right, perfect. All right, thank you. So the bill passes unanimously. Thank you very much, everyone. Also, I do want to take one moment and wish our council a happy birthday. Erin Hopwood had her birthday yesterday. And so thank you for being here today. And we hopefully we'll do some good work in honor of your birthday. So thank you. We're going to move on to House Bill 729, which is Public Health Use of Opioid Restitution Fund and Training under the Overdose Response Program. Erin, if you can talk us through the bill, and I believe we have a technical amendment.
Yeah, you have a reprint of the bill with a technical amendment included. The bill repeals the explicit delineation of certain authorized uses of the opioid restitution fund and instead specifies that the fund may only be used to provide funds for the purposes specified in settlement agreements and judgments related to claims by the state against the opioid industry for violations of state law. The bill establishes that these purposes may include addressing racial disparities in access to prevention, harm reduction, treatment, and recovery support services. The bill also alters training on responding to an opioid overdose that MDH may provide under the overdose response program to include emphasizing the restoration of breathing, avoiding withdrawal, and compassionate post-overdose support and care. You'll see in your reprint that if you look on page 3, starting on line 21, and then continuing on to page 4, ending on line 11, these were the specific delineated uses for the ORF that have been struck from the bill. The bill is introduced, only deleted half of them. It was just a drafting error. So the amendments delete them, all the specified uses.
Thank you very much, Erin. And as I recall, this is clarifying in nature to try and make sure that we're moving those dollars into the communities. And there was no fiscal impact. Am I correct too that this amendment will it will align it with the Senate cross-file?
Yes, as passed by Senate Finance.
All right, thank you very much. Do I have a motion on the amendment?
So moved. Move favorable.
Second.
All right, it's been moved and seconded. Any discussion on the amendment? All right, all in favor, say aye. All right, anyone opposed? Go ahead and raise your hand. All right, and do I have a motion on the bill as amended?
So moved. Move the second.
All right, it's been moved and seconded. Any further discussion on the bill as amended? All in favor, say aye. Anyone opposed, go ahead and raise your hand. All right, thank you, everyone. That bill, House 729, passes unanimously. Thank you so much. All right, we're cranking along. We're gonna move to. Do we
Question.
have? Oh, yes, Delegate Rosenberg.
I'm looking since to see about the Senate cross file was laid over. Does anybody have any idea why it was laid over, or if not, it's up to me to try and find out as the sponsor.
Yeah, I
on
don't
this.
know, but you could find out between now and Friday.
Okay, thank you.
Thanks.
Maybe they had to fix the same drafting error. Well, we can figure it out. We'll figure it out.
Thank you. Thank
Thank you,
you.
Delegate Rosenberg. And thank you for pointing that out because it passed out of finance, but has not passed the Senate yet. Do I have Delegate? All right, I don't. Oh, yes, I do have Delegate Lehman. We're going to move to Delegate Lehman's bill, House Bill 798, Opioid Restitution Fund Interactive Dashboard. Aaron, go ahead and talk us through the bill, and then Delegate Lehman, if you could let us know where we are, because I understand there are still some ongoing discussions with MACO. So Aaron, and then Delegate Lehman.
Okay, you have, well, first I'll just go with what the bill did as introduced. It requires the Maryland Office of Overdose Response in collaboration with MDH to develop and maintain an interactive dashboard on opioid restitution fund spending to share prescription opioid related settlement information with the public. Opioid restitution fund monies as appropriated through the state budget must be used for the dashboard. A county or municipality that receives settlement funds must provide MDH with specified information to include on the dashboard, and MDH must establish an online portal for a county or municipality to report or upload information. To the extent possible, the dashboard must use existing platforms that provide data on opioid use and overdoses in the state. The reprint that was provided for you incorporates amendments that were offered by MACO at the bill hearing. On page 2, this amendment would, instead of providing information on public hearings, the state, local, and municipality websites would be required to provide access to the respective state, county, and municipalities' use of settlement funds. And then on line 25, this amendment would require MDH to upload opioid-related settlement information submitted to MDH by a county or municipality in compliance with the terms of any settlement agreement. And the amendments also provide that a county or municipality that complies with existing opioid settlement reporting requirements and has shared that data with the appropriate state entity shall be determined to have complied with the bill.
Thank you, Aaron. And Delegate Lehman, I do understand that there was a concern about not having captured the data on the website if we were putting a link to the website, but there wasn't accurate data. So and I understand you've been talking with MACO. So where are we in those conversations?
Well, so I just had a chance to see that last amendment, and I have tried to work with them to avoid what they raised immediately to me last fall, which is what they call double reporting. And they said, we're already providing a lot of information to MDH. They don't really do anything with it, and actually, MACO was really supportive of the idea of a dashboard. They said, it would be great to have more transparency and get that information out to the public, but they didn't want to be to have more reporting requirements than they already have, which I understand and appreciate. My concern about that last amendment striking references to public meetings or public hearings is that that's the kind of real-time information that I think some people would be looking for. People who are just, families and friends and loved ones who are just beginning to deal maybe with an addiction situation or some recent event, a possible overdose or something on those lines that wants to know in real time what is happening at the local level. Are there public hearings or meetings, trainings, anything that I can get involved with? And so I did so my concern is by just saying there has to be a link back to the municipal or the county government website, that if there's no information on that website, it's pretty pointless to refer people back there. I did a quick test sort of Anne Arundel and Prince George's counties, because those are the two counties I represent. I am pleased to report Anne Arundel has a significant amount of information. I just went to their main page. I typed in opioid education, and popped up a whole host of things. Nothing on public hearings per se, but it was real time in the sense that it showed if you are interested in training, for information about overdose situations and how to use Narcan. It was right there. So I have to assume that's real time. They must do these trainings periodically. On Prince George's, not as thorough a response. It took me to a mental, health services site, and then there was a link to, drug and alcohol information. It wasn't, I don't think nearly as effective. My concern would be, all local and, municipal and county governments aren't created equally, that you would get a mishmash of websites that may or may not have information that someone's looking for. So I don't know what the solution is. I can certainly continue talking to Mako about where there might be, kind of a meeting of the minds on this. But that's my reluctance to adopt this amendment the way it's structured right now.
All right, thank you, Delegate Lehman. And I see we have a hand from Carrington Anderson from Mako.
Thank you. If I may, and Delegate Lehman, we're happy to continue working with you. This is one of the amendments that we spoke with your staff about when we met before the bill hearing. And I guess one of our concerns is by having the public hearings, again, like you said, not every county looks the same. So not every county may be having a public hearing. And so that then would require, or say the public hearing changes tomorrow or changes in a couple days, it would require counties to be going in and changing that every couple days, and it could result in having inaccurate or out of information that's not as updated on the website. And this is actually something that we talked with the Maryland Office of Opioid Response, and I believe this was something that they were supportive of as well. Of course, I don't want to speak for them, but want to keep working with you, but just wanted to throw that out there.
Yeah, I appreciate that. And again, Madam Chair, I'm open to a further conversation, and think we can probably get to consensus on this. I understand your point, Carrington, about, the information not being, completely up to date if the, hearing is moved or canceled. But going back to my initial statement, I think it would create frustration by users if they see a link that takes them to a website where they can't find anything at all, because back on that website, that city or county website, there just either is no information, or it's so sort of deeply buried people can't find it. And I don't know exactly how to get at that, but I would appreciate continued conversation and including with more. If they have further ideas. One of the witnesses, Madam Chair, at the hearing spoke about how important she thought it was. And then she was from a national group that said, Maryland could really stand out and stand up there with North Carolina and a handful of states providing this level of transparency. But she talked about the importance of real-time information on public hearings and public meetings, and how that alone would be really useful.
Well, and here's what I'm going to do, and what I'm going to suggest, because I'm going to hold this bill to give you more time to have those conversations. I am going to suggest that this might be a dual effort, because requiring notice of public hearings in the state law, if they're not actually occurring in the counties, I don't think gets you to what you're actually looking for.
Right.
So I'm going to suggest that we hold this bill look at that amended language, but also talk with MOOR, talk with Moore and with Mako to figure out if there's a path for Moore to work directly with the counties to make sure that there's some alignment on what those websites look like. Because I don't think necessarily we can be that prescriptive in
Right.
state law, but creating this framework and then making sure that the counties continue to design some alignment across counties. I think it would be a worthwhile effort. So I'm going to hold this to give you more time, and if you can reach out to the overdose, the Maryland overdose. I keep trying to say OOCC,
Moore, yeah.
MOOR now. And reach out to Mako and also to the department and see if we can thread that needle. But I do want to look at that language because I think it might be consistent with what we can do at the state level.
Okay.
And then I think there's a second tiered effort that we need to do
Yeah.
it.
Thank you. I appreciate your thoughtfulness, and I'm open to suggestions from you, Madam Chair, or anyone else on this subcommittee. And Carrington, I look forward to continuing to talk with you. I think we can come to consensus sooner rather than later. I know we will. I'm confident of that, and I thank you for your patience. And
Thank you.
yeah,
you all
thank
very
you to
much.
Erin Hopwood. She's been amazing. I meant to do a shout out to you, Erin, at the bill hearing because you have been wonderful to work with. So thank you. Thank you, everyone.
Were there any other comments from the members before we move on? All right, no, we're going to hold this bill for another week, see if we can work it out and get to the data that we're actually looking for. And with that, we're going to move to House Bill 334, Universal Newborn Nurse Home Visiting Services Program, Establishment and Insurance Coverage. This is a bill we held from last week because we were continuing to do some work on it. So Erin, if you can talk to us about where we are. And I also want to thank Delegate White Holland and Delegate Hill for your continued work on this as well with Delegate Kerr, who went over to the other subcommittee because he has every confidence in the work that's been done.
So I sent a updated work group based on the conversations last week in subcommittee. The membership has been expanded to include a pediatrician, a nurse midwife, an obstetrician, and a representative of a federally qualified health center. The staffing is being, you'll see in subsection D, says the Maryland Family Law Network may provide staff for the work group. And that goes to the fact that the General Assembly can't require a private entity to staff a work group, but they can authorize that entity to staff the work group, just with the understanding and hope that they will do actually staff the work group. One way to make this provision stronger would be if the Department of Health would be willing to at least put themselves in the bill as assisting with staffing. Most likely they would not have to do anything or even that much. I'm thinking maybe provide space if that would be what the Maryland Family Network would need. So those are the changes from last week.
All right, thank you, Erin. And before I ask for a motion, I just want to hear from Maryland Family Network and from the department. I'm not trying to put you on the spot, but I think we're very close to a consensus here. So let me start with Maryland Family Network.
Thank you, Chair Bagnall, and thank you, Erin, for your work on the language with regard to staffing. Maryland Family Network is willing to partner. We would appreciate a stated commitment from the department. We're mostly concerned about access to data and just overall collaboration and partnership with the public agency in hopes of making the work group report something that's useful to this committee next year. So again, we are willing and able to staff. I don't think space would be a concern, but we would welcome some kind of commitment to partnership and access to data from the department. And Erin, you have a letter from Maryland Family Network indicating our willingness to partner and to staff. So I'll be happy to answer any additional questions.
Thank you very much, Ms. Moreau. And Sarah Case Heron, I'm not trying to put you on the spot.
No, no, understood. Aaron did warn me. So while obviously we do think staffing would have staffing wholly would have a fiscal impact. We are willing, if Maryland Family Network is willing to take on the bulk of the staffing piece to accept kind of that conjunction language.
Huzzah. I love hearing that kind of collaboration. With that, is there anyone else who wants to be heard on this bill? Then can I have a motion on the amendments? Oh, Delegate Riley, go ahead.
Thank you, Madam Chair. So basically, the amendments, because I remember the hearing and it said, the staffing was the part that, caused the fiscal note to go way up. So we suggested to do a work group with volunteers. So I see that you're willing to be the volunteers in that. So it takes away the staffing requirement. But I'm hearing you say, with you actually being an organization that will strictly be volunteers gathering this information, is there going to be any issue, working with an actual department to give you access to information, or is that jeopardizing, access to individual records? How can you explain how that's going to work? What kind of information are they going to be sharing with you and that you will be collecting as volunteers?
Aaron, do you want to just speak to the procedural piece of that, and then we can
Well, I think maybe Maryland Family Law Network, I always get Maryland Family Network could speak to like who they are and what they do, because I don't think they're necessarily this group of volunteers. I think they have a very clear mission, and they're here, so maybe they could talk about what they do. And then in terms of the work and the data needed, that's outlined in the parameters of the purposes of the work group.
Thank you. And go ahead, Ms. Moreau.
Okay, thank you, Delegate Bagnall. Delegate Riley, Maryland Family Network is a statewide nonprofit organization serving children birth to 5, and we run many networks that provide supports to families and are very interested in home visiting, and don't see any issues around collaboration with the department in terms of the scope of this bill.
Okay, so there's no individual privacy that's going to be put out there or anything. It's just basically getting data on healthcare purposes.
Madam Chair, my understanding of the scope of the bill is that there's no personal level
Okay.
data that would be involved in the scope of the work.
Okay, thank you very much. I appreciate it.
Delegate Lopez.
Thanks. So I'm looking over this and perhaps I missed this, but is there someone here that is trained to a high level or has some type of mandate for cultural competency? Because this will be something very important. If it were to be implemented in my district, doing outreach to immigrant communities would be very important.
Okay, thank you.
And it looked like, this is a very impressive list. I don't want to slow this bill down at all.
Is there anyone on here who can speak to that? Who would be best to speak to that? I see, Miss Olivia.
Hi, I'm Pilar Olivo with Family Connects Frederick County, and I believe the focus on workforce needs will be a very important topic for making sure that we are looking at the cultural competency requirements of the workforce that's needed, as well as recommendations for addressing those cultural alignment needs.
Is there a way to add language in there to make that clear?
I'm seeing a head nod from Aaron.
Right?
We could say identify workforce needs, including cultural competency requirements, or not even requirements, or just addressing cultural competency.
It would give
be
me,
added there with the
give me a
needs.
little bit of comfort.
I think that's a great recommendation. Thank you.
I think that's an excellent recommendation. Knowing that we don't have that amendment, but that we have it in concept, does the subcommittee feel confident in moving the amendments knowing that we have this conceptual amendment that we'll have before we actually vote the bill? In other words, do I have a motion on the amendments, including the conceptual amendment of cultural competency?
I'll move them.
Conceptual one.
Do I have a second?
Second.
All right, it's been moved and seconded. All in favor of the amendments, including the conceptual amendment, which we will have before our voting session on Friday, say aye. Anyone opposed to the amendments, go ahead and raise your hand. All right, do I have a bill? Do I have a bill? Do I have a motion on the bill as amended?
Move the bill as amended.
I'll second.
All right, it's been moved and seconded. Any further discussion? Questions, comments? All right, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. I want to thank Delegate White Holland, Delegate Hill, and Delegate Lopez all for your work. I want to especially thank Erin and Maryland Family Network and the department. This definitely is a moment where it takes a village, but this is going to give us some really good data on how to make sure that we're doing everything we can for healthy moms and babies in Maryland. So thank you so much to this subcommittee for all of your hard work. And with that, we have completed our work for the day. So if I can have a motion to adjourn. So moved. Second. All right. Thank you, everyone. We are adjourned. I will see you at 1 o'clock.